By 1985, England was treating factor VIII to kill both HIV and hepatitis C. Scotland was experimenting with its own methods and only killing HIV.
In England, there were no new hepatitis C transmissions after 1985. Tragically, in Scotland, that wasn't the situation. If I was a patient with haemophilia and I was being prescribed factor concentrate, I would expect that it was the safest product available on the market. I wouldn't expect that I would get a differing quality of product in Scotland than in England.
I refute that there was a delay. There was no delay. There was an issue of implementing in a complex manufacturing plant to quality standards that we've discussed are really important. And that took a little bit of time.
Bill was one of the last haemophiliacs in Britain to be infected with hepatitis C through factor VIII, a fact he was unaware of until he went to an event in Wales organised by the Haemophilia Society.
There was a doctor and a few haemophilia nurses there, and they said, what's your factor VIII percentage? 41. So you're a mild haemophiliac? Yeah. And when did you actually get this factor VIII injection? 1986. 1986? And it was the reaction of those nurses and the doctor that actually started to, I think, make me inquire as to really what had happened.
Bill was later told that under the circumstances the doctor had done his best. But there were recommendations years earlier that factor VIII should be avoided for mild haemophiliacs. We've also spoken to two independent experts who say that there were alternative treatments. That according to best practice at the time, you should never have received the product you received.
I'm very shocked about that. I think we've been misled. I never knew that, and I'm angered by that. Because I've sat in meetings with the Scottish National Blood Transfusion Service, I've talked to doctors and specialists about this, and I simply cannot believe that they didn't know that, and they've sat and stared me in the eye as I'm talking to you just now, and I am very angered by that.
During this time, some of Dr. Ludlam's patients still did not know they were HIV positive, although Dr. Ludlam knew. But in 1984, an internal advisory document clearly stated that patients should have been informed, reassured and counselled. It was 6 years later when Dr. Ludlam told John of his diagnosis, recording in John's medical notes,
I have told him of his HIV status. He had not really suspected that he might be positive, and he was therefore quite taken aback.
Why didn't they say, you know, he's been infected. He's HIV positive. Why wasn't I told? Why weren't my parents told? At 14 years old.
Dr. Ludlam says that he told his patients they should practice safe sex. Without knowing they were HIV positive, they had no idea of the significance of that message.
We were actually thinking about having another child, yes. I wanted to have another kid. Most definitely.
And you were told there was still no risk?
We were told there was still no risk.
It would be unforgivable to leave somebody in a situation where they had a viral illness that was transmissible, that could be passed on to their spouse or partner.
As you were growing up then as a teenager, did you have girlfriends?
Yes.
And did you have sex with those girlfriends?
Yes.
Whilst John and Robert were living in ignorance, Dr. Ludlam was using their cases for medical study and publishing the results.
I've found papers that Dr. Ludlam has written in the past regarding this unique group of haemophiliacs who were infected at Eleanor Bradford in 1984, which indicates that he knew all along that we were all infected. Why he reneged from informing us that we were infected is something you'll have to ask Dr. Ludlam.
We did, and we asked Professor Ludlam whether he thought it was appropriate to publish on Robert and John when they didn't know they were infected. He didn't respond to our question.
What actually went wrong? Did somebody cut corners? Did somebody do something they weren't supposed to? The person that I point the finger at is Professor Ludlam. He was the consultant, so from my point of view, he's top of the tree. I'd like him to explain why we weren't told, what happened, in detail.
Professor Ludlam says he took seriously his responsibilities for the pastoral care of his patients. When asked why they were not told in 1984, he said,
Patients were also encouraged to make an appointment to see their haemophilia doctor for more information and to discuss their own test results.
In all, we've spoken to 4 patients or their families who say they were never encouraged to make any kind of appointment.
How you judge society is determined by how society treats its most vulnerable people. Each one of us can, at some stage in the future, find ourselves in a similar position. And we would like to hope that the state or its entities would treat us in an appropriate manner. So we all can learn, and we all can benefit from the assurance of a proper response to each health catastrophe that occurs.
The government has made payments to haemophiliacs infected with HIV and hepatitis C. These range from £20,000 to £60,000 and are not always paid to the families of those who've died.
It doesn't go far enough. Nowhere near far enough. I mean, how much do you put on taking away the right to people have children? You put a value on it. To have intimate relationships with your partner. What price do you put on that? I don't know, you put a price on it. You tell me. But certainly the ex gratia payment that we receive does not cover any of that by any manner of means.
Much of the information in this programme has never been made public before. How donors were from prisons and US bases, that facilities were poor, and some doctors let their patients down. And yet the executive says there's still no need for a public inquiry.
We have great sympathy with those affected and their families. The treatment given to haemophiliacs was provided in good faith by the health professionals involved. The risks of that treatment were not known at the time.
The common thread in it all is that they're actually aware that something went wrong in terms of the decision making. That is the common thread, and that's the sort of that's the thing that commonly eats away at everyone, that possibly the best practice was maybe not adopted actually.
Nearly all of those infected with HIV in Scotland are dead. Hundreds of others are living with the effects of hepatitis C. Even though their numbers are dwindling, there are others who will fight for answers.
There will be families of the deceased who will continue the campaign for an inquiry into why this disaster happened. It is the worst medical disaster this country has ever had.